question. And how come you get to read this and I read this? Rejuvenate your skin with these products on display. It's a beautiful thing. Plus, we go behind.
It's a great day, so make it everything you want it to be. It's yours and it's mine. It's a great day to shine.
Welcome back to The Blend. Many celebrities are going under the knife to perfect their look. You may feel the pressure to do the same, but with all the hype surrounding plastic surgery, lasers, and cosmetics, we're looking for answers this morning, and our next guests are here to separate the hype from reality. Dr. Giselle Anson and Dr. Terry Higgins are here with more. Good morning to both of you, and welcome.
Good morning.
Can you tell us a little bit about your practice?
Well, we have rather an unusual practice in that we're partners. That is a little bit uncommon in plastic surgery. But what it allows us to do is, develop an expertise in particular areas. Terry does breast and body contouring, and I now focus just on facial aesthetics. So it's nice to be able to just do that.
It's an integrated approach at your practice.
Exactly.
Tell us about that a little bit.
It's more than integrated. We actually, there's the two of us, which you mentioned already. We also have 3 full-time estheticians. We have nurses, medical assistants, but we also, more importantly, have a board-certified dermatologist, which we brought on board a few years back now, Dr. Allison Tam, and she specializes and brings a focus of her expertise on laser skin resurfacing treatments as well as hair transplant therapy to our practice.
And that's a big thing right now also, and it's not just the men that are losing their hair, it's the women as well. Can you help both sexes?
The hair transplant is amazing. Dr. Tam does really a beautiful job. It's not like the old days where you can see it from across the room. Now with the single follicle grafts, you really can get a beautiful result. And people always think of it as a male thing, and you're right, women, it gets no attention, and it's a huge problem among women. She's got some great results.
Yeah, because women, you can see it at thinning hair just like men do, so it's a big concern for both people.
And who wants to wear a wig forever?
Yeah, and let's go ahead and talk about the training and your staff a little bit.
We have a great staff. We've sort of evolved over the years. We now have 3 full-time medical estheticians who do nothing but medical skin care. We have 2 clinical coordinators. We have a really great staff because our goal really isn't to do a single surgical procedure for our patients. Our goal is to establish a relationship so that this is a lifelong relationship, not just a single procedure.
Right.
That's not our point.
We're not interested in selling any one thing in particular. We want to bring the patient in, and we talk about that integrated, coordinated care, and that's part of it, because we can be in the office on the same day, myself, Dr. Anson, and Dr. Tam, and a patient may come for one of the consultations to see one of us, but their concerns when they come in are broad and cover all of our areas of expertise, so that same patient may see all 3 of us in the same office day, because we make our office days the same so that we're available for that. So you may get the three experts at the same time, at the same office visit, which is highly unique.
Yeah, and people are so busy, they like that. It's just easy, you get in, and then you're done. So,
and with each area of expertise, I mean, no one can be an expert at everything.
Exactly.
And this way, we can each provide state of the art with our areas.
Specialty.
And then the three of us can put together a comprehensive plan that's not just cut and paste, but it's a unified, comprehensive plan, because that's what most people need nowadays. Because it's not just one or the other. Usually, it's both and combined.
Yeah. Because people start these days with skin care. Then they move on to the non-invasive things like Botox, fillers, things like that, laser treatments, and then move on to surgery.
And I'll toot our own horn. She mentioned Botox and fillers sort of casually, but our practice has been recognized as the top 1% in the nation as far as the amount of Botox and facial filler that we actually do and perform. So
we do a lot. We do a lot.
Yeah, it's your expertise. You know what you're doing, and you've done it plenty of times, so there's no worries.
It's nice.
And speaking of skin care, you brought some things in. Let's talk about what this is. And it's just like your car. You got to take care of your face.
Absolutely.
And your body.
The most important thing anybody can do is skin care. It's a basic thing. Whether you're 20 or whether you're 80, it's cheap, it's easy, it's effective. So when I say skin care, I mean seeing a medical esthetician or an esthetician periodically for guidance on what products to use, and periodic exfoliation, periodic treatments. And the products are important. They're slow acting, but they're very important, easy.
So we spent some time developing our own skincare line out of frustration of what was currently available and the expense of medical lines that were available. You can go into Sephora or Nordstrom's or CVS or even Walmart and look at the myriad of products, and most people have no idea of how to use those products and what components are the effective components, and most things over the counter that aren't medical grade, the active ingredients are such a small amount that they don't actually do what they're supposed to do.
And
This
it can
way-
be so confusing for the average person
So
coming
it
in.
can
They
be
don't know what they
overwhelming.
need, and they're buying things they
Right.
don't need.
Right. You can waste a lot of money doing that. You really can. Instead of having a targeted approach. It's the advantage of having our own skincare line is we can really, we know the concentration of the products. We know what the active ingredients are. I mean, everyone should be on a retinol. Everybody should be on a topical antioxidant that we know actually penetrates the skin.
That works.
Really, the active peptides, sunscreen, those are all basic. So you mentioned out of frustration we did this. And then, you know, now that we're getting into it, and there's so many cool new products out there, we've been working on some new things that should be out in the next
Yeah,
year or so.
we just met with our chemist last month, and we're working on some new product line that's developing basic stem cell activators. I mean, everyone's heard about stem cells and kind of what they can do, but what they can do on the skin is pretty amazing. And so we've got a new skincare line we're developing currently based on stem cell activators to reverse the signs of aging.
And very quickly, we have some before and after pictures we want to show people.
Sure.
So let's go ahead and take a look at this. Tell us what we're seeing here.
Okay. This is a patient who had already had a little bit of filler. This is a before and after front view of facelift, eyelid surgery, neck, you know, and that includes the neck, and I think we did fat injection.
Yeah, her after shot looks really beautiful, and she still looks like herself
Yes.
instead of overly done where you
Soft.
can see.
Right. The natural result is
Yeah.
super important. Our patients are much more sophisticated these days. Do you have a side view?
Let's go ahead and see if we can take a look really quickly, and then
yeah.
we have to go. But tell us really quickly about
Well,
this.
before I start talking about myself, and just talk about Dr. Anson for a second,
Yeah.
there's only a handful of physicians in the U.S. that specialize solely in face. There's a handful, and she's one of those physicians, and it's a credit to her, and it's a credit to her patients coming to her, because it's made her a nationally recognized leader in that. Getting onto these photos, this is a mommy makeover type stuff, typical tummy tuck things we see, which is extra skin, loosened muscles. This is a typical male patient, which we don't always think about, but male patients for tummy tuck and liposuction, and the results can be fairly impressive, as you can see from doing those two procedures
Big
together.
changes.
Big
And
changes.
Natural results.
Yes.
That's what he's best
That's
known
key.
for. It's really
Thank you
important.
so much. We've run out of time. We
Oh,
appreciate
sure.
it so
No
much.
worries.
Okay. Again, for more information on Anson Higgins Plastic Surgery Associates, they are located on Sunset Road. They offer complimentary consultations. Either call or visit the number that you see right there on your screen. We will be right back.